Well, I'm delighted to kick off our kickoff, and what we're going to do is go over an overview, and Steve's going to handle most of that, and then we're going to get into some more of the detail. And don't forget the solution fair here later on for all the employees. Well, I thought Steve found this, and I thought this would be a fun way to start it off. Now, make sure I do this right, Steve. No? Okay. Now, on this one, you can sing along too. Your song. I'm not very YouTube savvy.
Once upon a time, back in the old days, we had a paper chart we loved it so. We kept it in a rack there at the station and chased it all around when it would roam. A busy place, we had a lot of patience, and every time they came, we'd ask the same. History, allergies, and medications. No matter what, we write it down again. Those were the days, my friend. I'd bring my favorite pen. The paper chart was all we ever knew. We'd write the orders down. With luck, they could be found. Those were the days, and yes, those were the days. La 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 not so fast, we tell the impatient. Say again what you're allergic to. Your history lies somewhere in the jungle. Med Records has just put a trace on you. Doctors, they would write down all their orders, place it in the rack so carefully. The nurses, they would huddle all together, frustrated by the scratch they had to read. Those were the days, my friend. I bring my favorite pen. The paper chart was all we ever knew. We write the H and P. No one could read but me. Those were the days. Oh yes, those were the days. La 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 everyone would write their little piece down on forms and forms and forms and forms galore. Admittedly, we used a lot of paper, but isn't that what all the trees are for? Those were the days, my friend. I bring my favorite pen. The paper chart was all we ever knew. We'd write the orders down. With luck, they could be found. Those were the days. Oh yes, those were the days. La 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 la. La 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 la. Those were the days. Oh yes, those were the days.
No one sang along. How do I get back out of here? Well, we thought that'd be fun, because we're going to have to look for ways to have fun through this process. As you know, it's going to be a big challenge. A lot of work's been done. We know we have the best system that we'll be bringing in for our health system, and we're delighted by that. But, you know, I think about paper charts. We used to have a vascular surgeon. We used to have to go out to his car and get the charts out of his trunk. So there's a lot of things that are going to change for us. This is by far a transformational process, and it's going to change the way we communicate with each other. It's going to change the way we communicate with the patient. So a very big change is where we're going. We do have a vision statement, and this is what's driving us to get to this vision. And you know, I think of my 25 years here, and I think of all the projects that we've done right at the beginning when we did the financial turnaround and all the major projects like emergency room and North Points. Many of you have heard me say this is the most disruptive project that I can think of in 25 years. And it will be managed and it will be led very well, but it is a challenge. There's also a very big positive in this for me. This was one of those projects that kept me awake at night, in the sense of, do we really have the resources to be able to do this? Or would this be the time that we might have to find a bigger partner to be able to bring on this multi-million-dollar computerized electronic medical record? And I'm pleased to say, yeah, we're going to finance this ourselves. So not only do we have the capital resources, but what I'm very comfortable, confident with, is that we have the human resources. People in this room, the teams, in the departments, that will be able to implement this and allow us to go live in March of next year. So I'm very positive about the project. I'm very delighted that we're able to do it at this time. We all know it's going to help us deliver better care. It's always been part of our mission. How do we always improve the quality of the care? We know it's going to help the business office with their billing. And don't forget, if there's no money, there's no mission. So we want to make sure that we're able to, track the bills and get the bills out. There'll be less duplication. I think as the song pointed out quite well with the paper charts. And there's going to be a nice patient portal. Now, I think patients in the community are very excited about that. Physicians, I don't know if they're as excited. But that will have to be managed as well, and how that is utilized. But that will be a big aspect of furthering our other part of our mission, and that's patient satisfaction. So we're very pleased that we're able to do this kickoff today. As part of the kickoff, we wanted to name the project. And I wanted to give you the results of the naming. We had a number of people from all over the system, clinics as well as the hospital, submit some names. And I want to thank Sarah Starmer and Connie Jones. They helped us in this little contest. And the grand prize is a $100 certificate to North Point. But there are some that we thought deserved attention and recognition. And so we're going to do some $25 winners. And as you can see up there, honorable mention goes to Darla Olson. Cheryl Hendrickson, did I see Cheryl? You come right up here. I'll give you yours first. Very good. Congratulations. And then we had a runner-up. It was a well of a name, and that was Dr. Fromm. Dr. Fromm, you can come up here. All right. The grand prize winner was submitted by Heather Strait from the Beloit Clinic, Medicare and Medicaid reimbursement. Is Heather here? Okay. And this is our name. Tower will be the name of our project. And we even have a graphic, and Connie Jones who did this graphic for us. And so you'll be seeing this on a number of different communication pieces as the major project that we are working on. I think with that I'm going to turn it over to Steve, and he's going to do some project overview. And there you go. It's all yours.